You're here because you want to learn how to take care of yourself. There isn't anything more important than that. Not just for yourselves, but for everybody else. Congratulations. I'm delighted that you're here, and I hope that this conference was some help to you in accomplishing your goal, which is really important. And how do I advance the slides? Great. I'm going to talk about something that you know already, but you're kind of taught not to pay attention to it. Doctors are taught not to pay attention to it because it's complicating. How do you know when you're sick? Well, it's very simple, really, when you don't feel well. If you don't feel well, you're sick. Something you want to do, but you can't do it, you're sick. And it's really as simple as that. This is a way of looking at it. The green is when you're well. The red is when you're sick. When you don't feel well, when your head aches or you can't see. And the yellow is in between when something's going wrong, but it's a little hard to tell. So keep that in mind. When you're in that green zone, you're well. You're well. You're doing fine. How do doctors know you're sick? Well, doctors think you're sick when you're different from what's called normal, the so-called normative database. When you're not normal, then you're sick. Because doctors go along with things they can measure more easily, such as pressures or blood sugar, things like that. Well, so what is normal? Well, there's a scientific definition of normal. It came from the Carpenter's square, which was an absolutely standard shape. So you always knew exactly what that right angle was. So if you're making a wall or a building, you could use that, and that would tell you that was the right thing, the right angle. So that's where it came from. And then it sort of became, well, what's average? Because what's average is, most people, that ought to be okay. And then it got a little more scientific. Let's say, so what's 99% like average? Because there'll be something that's a little bit different. And that's normal. Now with eye pressure, 15 is the average, and between 9 and 21 is where 99% of the people fall. And the way you think of that is, how far is a person different from that average? And if they're more than a certain distance away, 2 standard deviations, or if you want to be a little stricter, 3 standard deviations, then they're sick. So this is what governs all of medicine and science, basically. It's called the standard distribution curve. And it says when you measure something, there's going to be a measurement which is more frequent than everything else. And then they're going to be, the farther away we get that frequent, and it becomes rarer and rarer. And between the measurements there in the middle, 1 and -1 and +1, that's where 2/3 of the people, 2/3 of the measurements, anything you measure, tend to lie. And then between -2 and +2 standard deviations, that's where more lie. That's where 99 or 95% rather lie. And then when you get out to 3 standard deviations, then you get to 99%. So if you're more than 3 standard deviations away from normal, from the mean, well, you got to be sick, right? Now, sometimes that curve has different shapes. Sometimes there are not so many people in the middle, and there are many people more off to the side. Sometimes it's steeper with more people in the middle and fewer people to the side. But that curve is what doctors have in their mind all the time, because that's what we're taught. So, how do you do that with regards to what's important in glaucoma? One of the things that's important is the pressure in the eye. Well, you measure a group of people like you, and what's the average? Well, that's what a doctor, an ophthalmologist, and an epidemiologist did in the city of Ferndale, a small mining town in Wales. And this is not the same curve. It's a little bit different shape because this is a logarithmic curve. So you'll notice on the left it goes by jumps of 10. So it looks a little more bunched together in the middle there. But what it says is, okay, there's the curve, and the mean is 15, and there are more people a little higher pressure because some people have glaucoma and their pressures tend to be higher, right? But this group, Peter Graham and Fred Hollows, didn't just look at the pressure. They also looked at the optic nerve, and they also looked at the visual field. And based on the optic nerve and the visual field, they decided whether the person had glaucoma or not. This is one of the great epidemiological studies. Those little dots that you see, those little dots are the people who had glaucoma. What doesn't seem to make sense? Well, if glaucoma is a disease of pressure, which certainly is, here's a person whose pressure is absolutely on the average, 15, but that person has glaucoma. And then there are people way up with pressures of 30, which is 6 standard deviations above the mean. 6, not 2, 6. Who don't have glaucoma. Because there are lots of people in that area who have elevated pressure, but who don't have glaucoma. Everybody's unique. Some people, even though they're average, are sick. And some people, even though they're not average, are not sick. And that's really important to remember. Let's look at a couple things. In the United States recently, if you combine the genders, of course women live longer than men, but if you combine them, most people lived on average to be 70 years old. Does that mean when you get to be 70, the next day you die? So I'm dead 15 years. Well, that's another way of looking at it. The blue line is how old people are. And you'll see right up there, 70, average here. But when you're 70 years old, even though that's when most people are dying, when you're 70, you have about 25 years to live on average. But that's average, because you know perfectly well that somebody 70 is going to die tomorrow. And some of those people who are 70 are going to live to be 100. So these averages tell us about populations, but they don't tell us anything about me and you. Because you are not a population. This is something that has influenced the way doctors take care of people with glaucoma. This was a study in which people were followed when they had surgery or laser for treatment, and then the doctors went back and looked at all the pressures and who got worse and who didn't get worse. And this was published. This was in the best journal. This is the way doctors think. Okay, on the left, that vertical thing, that's visual field getting worse. On the right is time. It's a long study, 88 months they followed these people. And during that period of time, the visual field got worse in the red group, a little bit worse in the blue and the yellow group, and in the white group it didn't get worse at all, right? The people in the yellow group, in the white group, they had pressures that were consistently below 12. So doctors say, okay, you come into my office, you're going to have a pressure below 12, then you're not going to get worse. You come in my office, you got a pressure of 20, whew, you're going to get worse. What that graph doesn't show is that 14% of the people whose pressures were 12 got worse more rapidly than the people whose pressures were 20. And the people whose pressures were 20, half of them didn't get worse at all. So when your doctor says, oh, your pressure is 12, it's great, you should say, what's great about 12? 12 might be too high for me. They say, oh, boy, your pressure is 28. That's pretty trouble. Why? What's wrong with 28? People have pressures at 28 and do fine. If you're well, if you feel well, you are well. If you're getting worse, if you feel worse, you're seeing worse, I don't care what your pressure is, 28, 20, 12, 8, and you're getting worse because of your glaucoma, that pressure's too high for you. A little bit more about how doctors think. This is the same journal. This doctor, who is now one of the editors of that journal, looked at the place where the fluid runs out to find out, well, the relationship between the pressure in the eye and how much of that angle, so-called, is closed. And he found, wow, there's a great direct relationship, and look at me, I'm the first one to study it and report it. Wow, great news, right? And that's his data. If he weren't a doctor, he'd look at that and say, well, here's the number of clock hours closed, and there's no closure at 0. And over here, on the other end, way over here, I'm an IT idiot. At the other end, on the far end, that's almost totally closed. And on the left is the pressure in the eye. Well, I've put some red dots on those, and what you see on the right is there's the person whose angle is almost totally closed and the pressure is 18. Well, what's so bad about that? And there's a person whose pressure is totally open and pressure is 40. What he showed is exactly the opposite of what the journal published. What he showed is you cannot predict what the pressure is related to how much of the anterior chamber angle is closed. Exactly the opposite. of what it says in the abstract and what the journal published. That's the way doctors have been taught to think. There's a regression line. If p equals 0.001, yes, if your angle is closed, you're more likely to have a higher pressure if your angle is open, but who cares? You're not a population, you're a person. One more example. We spent a lot of time studying visual fields and preserving your visual field. Oh, your visual field's worse. Whew, wow. Well, if this is bad on the left and good on the right and on the top, you think if your visual field is bad, you're not going to be able to do things. If your visual field is good, you can be able to do things. Well, I've studied that. I've studied what people can actually do. Can they find boxes in a room? Can they recognize people at a distance? Things like that. 9 tests. And that's the relation in actual people. And what you see is up on the right-hand corner, most people who have a normal visual field, a good visual field, can do most of the things. But what you can see is way down on the bottom right, there's somebody who's got a perfectly normal visual field, and on the left is you can do things all the well. You're up at the top. If you can't do things, you're at the bottom. There's the person with a normal field who can't do anything. And up at the left-hand corner, there's a person who's got almost no visual field at all and can do everything. Yes, your visual field is important. Of course, if you're blind, you're not going to be able to do things as well as if you can see. You don't need to study to know that. But some people who are almost blind can do almost everything. And some people who see very well can't do much of anything. You are unique. There is nobody like you. Don't settle for trying to be average or normal. So, if you hear the word normal, you think of it the way non-physicians, non-scientists think. Normal means healthy, but that's not what it means to a doctor or a scientist. Because a doctor or scientist, it means average. Beware of being average. You don't want to be average. You want to be right for you. So, you know, you have too many red blood cells, polycythemia vera, they take your blood away. You got too few blood cells, you give a blood transfusion. The whole thing that doctors do is to try to put you in that normal, average range. Remember that graph. Now, do those things mean that all the findings are useless? No, because there are some thresholds which are really important. If your pressure is above 40, you're going to get worse. Everybody whose pressure is above 40 gets worse. If your blood pressure is 200, you're in trouble. So there are thresholds, and you need to know what your thresholds are. But if you're below that threshold, you're not 99% sick or 92% sick. You're either 100% well or 100% sick. So, those are some thresholds related to glaucoma, which are of concern. If you're getting worse at a rate which is greater than age, you're in trouble. If your pressure is above 35 or better, say 40, you're in trouble. If the pressure difference between the eyes is greater than 6, you're in trouble. If you have a disc damage likelihood score of greater than 5, you're sick. Always. If If you have an acquired pit of the optic nerve. But these things, which doctors pay a lot of attention to, they don't tell us whether you're sick or well. None of those tell us whether you're sick or well. So, when you feel worse, you're worse. When you see worse, you're sick. When you can't do something you could do before, you're in trouble. Pay attention to that. Listen to yourself. Believe in yourself. If you feel sick, and your doctor says, well, I can't find anything wrong, I think you're okay, you say, nicely, BS. Something's wrong. Find it. Something you can do for yourself. Test your own vision once a month. One eye at a time, because you see with two eyes, so if you test it with both eyes, you don't know when one's getting worse. But test your vision once a month. Are the two eyes seeing the same? Are they seeing different than before? If you don't notice a change, something may be happening. You might be in that yellow zone, and maybe your doctor can find a threshold that says, you feel well now, but you're going to get worse. But remember, it's got to be above a threshold. So keep that graph in mind. So this is the take-home. If you feel well, you are well. Now, sometimes even when you're well, you're going to get sick in the future. And if you're above a threshold, you have to pay attention to that. Sometimes you have to let yourself get a little bit worse before you know you're really worse, because there's a variability. You know, sometimes you feel energetic, sometimes you feel a little less energetic. So you want to build a trend. What direction am I going in? And sometimes, even when you feel well, you may need some treatment. But you don't need the treatment unless it's certain that you're going to get worse. The other side of that, if you feel sick, you are sick. Don't forget that. Believe in it. Now, there are some things, all you need to do is change your lifestyle. It's a much better way than taking a pill or having surgery. Much safer, much more effective. You don't want a pill, you don't want surgery, unless you need those things, because all of those things carry risk. So how do you know whether you're changing? Well, you need a good baseline. That's why I say measure your vision. Check it yourself. Listen to yourself. Watch yourself.